Hello everyone. In this session, we'll be learning about the ulnar nerve from the quick revision flowchart and the notes that we have made for you all. Okay. Entire ulnar nerve can be covered in this one single content which is visible on your screen. Okay. Many a times long question is asked on this topic or applied anatomy as a short note is asked. Okay. So it's a very important topic in upper limb anatomy. Okay. Link to access this PDF, I'll put it in the description box below. Okay. So let's begin with the ulnar now. So what is the origin of the ulnar nerve? From where does it arise? Okay, ulnar nerve arises from the brachial plexus. Okay, which part of the brachial plexus? It is the medial cord of the brachial plexus. Okay, ulnar nerve arises from the medial cord. The root value is C8 and T1, and it also receives the C7 component from the lateral root of the median nerve. Okay, so that's why the root value becomes C7, C8, and T1. Okay, so the other three root value components C7, C8, and T1. Okay, so brachial plexus is present in the axilla, and when the ulnar nerve arises from there in the axilla, it doesn't have any branch. Okay, then in the arm, it gives a branch to the elbow joint. Okay, branch is given to the elbow joint in the arm. Okay, then when it comes in the forearm, it gives some branches. In the flexor compartment, there is a muscle called as flexor carpi ulnaris muscle, one of the superficial muscles in the flexor compartment of forearm. Okay, and in deep group, it gives now supply to this muscle, the flexor digitorum profundus muscle. Okay, then a branch to the ulnar artery, a cutaneous branch which goes towards the palm called as the palmar cutaneous branch, and also a posterior or the dorsal cutaneous branch. Okay, so this is a general idea how the ulnar nerve passes from axilla to the arm and forearm, and we will just see the relations as well. Okay, in the axilla, the ulnar nerve lies medial to the axillary artery. Okay, and then in the arm, the ulnar nerve lies medial to the brachial artery, and at the mid arm level, it pierces the medial intermuscular septum to enter the posterior compartment of the arm. Okay, so it just enters the posterior compartment. It doesn't supply any muscle there. Okay, since it is behind, then it goes behind the medial epicondyle of the humerus. Okay, it's a very important landmark for ulnar nerve. The nerve behind the medial epicondyle of humerus is ulnar nerve. Okay, and then it passes between the two heads of flexor carpi ulnaris to enter the forearm. Okay, then before entering the hand, it passes through a space superficial to the flexor retinaculum, that's referred to as Guyon's canal. Okay, the nerve passing through Guyon's canal is ulnar nerve. Okay, so the course of ulnar nerve up to the forearm is clear, and majority of nerve supply ulnar nerve it gives in the hand region. Okay, so if we just go a little bit down towards the hand, so as we can see, many muscles are supplied by the ulnar nerve in the hand. Okay, in the hand there are 20 muscles, out of which 15 and a half muscles are supplied by ulnar nerve. Okay, and the these muscles of the hand they control the fine movements of the fingers. So that's why ulnar nerve is also referred to as musician's nerve. Okay, so how to remember the nerve supply of ulnar nerve in the hand? So for that, basically we can remember the 4.5 muscles which are supplied by the median nerve, and remaining muscles will be supplied by ulnar nerve. Okay, there are groups of muscles, the thenar group, the hypothenar group, the lumbricals, the palmar interossei, the dorsal interossei. Okay, so out of which 4.5 muscles are supplied by median nerve? There is a muscle called as flexor pollicis brevis muscle. Okay, flexor pollicis brevis muscle. Then there is opponens pollicis. Okay, now I'm speaking about the muscles supplied by the median nerve. Okay, the flexor pollicis brevis, actually the half part is supplied by median nerve, half is supplied by ulnar nerve. Okay, opponens pollicis. Then abductor pollicis brevis is a muscle, abductor pollicis brevis, and two lumbricals. The first two lumbricals, Also we can say the lateral two lumbricals. Okay, so two lumbricals, these two muscles, opponens pollicis, abductor pollicis brevis, and half of flexor pollicis brevis, these are supplied by median nerve. Okay, and remaining all muscles are supplied by ulnar nerve. Okay, the entire hypothenar eminence, the adductor pollicis muscle, the third and the fourth lumbricals, as the first and the second was supplied by median nerve. Okay, all the interossei, the palmar interossei, dorsal interossei. Okay, and it also supplies skin to the medial 1.5 fingers. Okay, on the palmar aspect as well as the dorsal aspect. Okay, so it has got a muscular supply as well as cutaneous supply. Okay, so ulnar nerve supplying majority of the muscles of the hand. Now let's look at the applied anatomy points with respect to the ulnar nerve. Ulnar nerve is referred to as musician's nerve, and injury will lead to motor and sensory loss along the area of distribution of the nerve. There is atrophy and flattening of the hypothenar eminence. Okay, this part here that's referred to as hypothenar eminence. So that region there is the atrophy because the muscles supplied by the ulnar nerve are present there, right? And there is something called as claw hand deformity. Okay, claw hand is basically hyperextension at the metacarpophalangeal joint and flexion at the interphalangeal joints. Okay, because the lumbricals muscles are affected. Okay, the normal action of lumbricals are flexion at the metacarpophalangeal joint and extension at the interphalangeal joints. Okay, when this is affected, it leads to claw hand, loss of abduction and adduction of the fingers because palmar interossei, dorsal interossei, they cause these movements. Okay, loss of adduction of the thumb. Okay, because the adduction of the thumb is brought about by adductor pollicis muscle. Okay, then there is something called as foment sign. This is for the done for the adductor pollicis muscle. A book is kept between the thumb and the index finger, and the patient is asked to grasp it. Okay, he won't be able to grasp it properly. So foment sign will be positive. Okay. There's a test called as card test or paper test. A paper would be kept between the fingers and asked to hold it tightly. Okay. Since palmar interossei muscles are affected, the patient will not be able to hold the card or the paper between the fingers. Okay. Igawa test is for the dorsal interossei muscle. Abduction of the fingers are tested against resistance. Okay. So that will be positive in ulnar nerve paralysis. Okay. Then there is a very important feature in ulnar nerve applied anatomy called as ulnar paradox. Okay, what do you mean by paradox? Paradox means we are expecting something and an opposite thing is happening. Okay, so what is seen in ulnar nerve? Let's see. A proximal injury of ulnar nerve leads to less prominent claw hand. Okay, and a distal injury of ulnar nerve leads to more prominent claw hand. Okay, usually nerve injuries we expect proximal injuries to produce more effects. Okay, but in ulnar nerve injury, the proximal injuries is leading to less prominent claw. Okay, why is it happening? Because whenever there is proximal nerve injury, the flexor digitorum profundus muscle is paralyzed. Okay, and flexor digitorum profundus muscle is responsible for flexion of the distal interphalangeal joint. Okay, so flexion of distal interphalangeal joint won't be possible properly, and that's why the claw hand is less prominent. Okay, in clawing basically what happens, hyperextension at metacarpophalangeal joint and flexion at the interphalangeal joints. Okay, but here the flexion of interphalangeal joint, the muscle that itself is paralyzed, so the clawing is less prominent. Okay, and whereas in a distal injury there is more prominent claw because of the flexor digitorum profundus muscle is spared. Okay, so sparing of this muscle will lead to more prominent flexion of the distal interphalangeal joint. Okay, that is referred to as ulnar paradox. Okay, so this was about the ulnar nerve. Let's quickly recap what we have learned in this session. Okay, we started with the root value of the ulnar nerve, that is C7, C8 and T1, and from where does it arise? From the medial cord of the brachial plexus. In the axilla it doesn't give any branch. In the arm it just gives a branch to the elbow joint. And in the forearm, it gives branches to the flexor carpi ulnaris muscle and the medial half of flexor pterygorum profundus muscle. And the cutaneous branches are given here, palmar cutaneous and the posterior cutaneous branches. Okay, and in the hand, majority of muscles are supplied by the ulnar nerve, except few which are supplied by the median nerve. Okay, and some important relations we saw. Ulnar nerve lies medial to the axillary artery, the brachial artery. In the middle of the arm, it goes posteriorly by piercing the medial intermuscular septum. It lies behind the medial epicondyle of humerus. Then it enters the forearm by passing between the two heads of flexor carpi ulnaris. It enters the hand by passing through the Guyon's canal. Okay. And here in the hand, we can see the cutaneous distribution of the ulnar nerve. The medial 1.5 fingers and the palm is supplied by the ulnar nerve, both palmar aspect as well as the dorsal aspect. And in applied anatomy, we saw ulnar nerve is referred to as musician's nerve because of the fine movements which are controlled by the muscles of the hand. Then injury to the ulnar nerve will cause atrophy and flattening of the hypothenar eminence, claw hand deformity, loss of abduction and adduction of the fingers. Then foment sign, card test, Igawa test, all these will be positive. Okay. And then we learnt about the ulnar paradox, how proximal injury produces less prominent claw hand and distal injury produces a more prominent claw hand. Okay. So link of this PDF would be there in the description box below. Do access it. Thank you.